The reason for this session today is to sort of like answer questions that you may have, even to reassure you of things that will take place and some avenues to follow when events begin to unfold. There are 4 main reasons that would override everything I say today. So please, please, please remember in mind the 4 points which override what I say today. Now, before we get into the questions, I just want to jot them down. So what things do you think in mind that are very important to you that you would call delivery suite immediately?
Stop bleeding.
Okay, so we said PV bleeding and a teaspoon or more. Okay, so bleeding in pregnancy is not something which is what we want to experience, but if it is happening, then you give us a shot and you ring delivery suite. Okay?
Reduced movement?
Yes, reduced fetal movements. Reduce fetal movements. If you wait until there is no movements, then that would not be nice. So reduce fetal movements. Now, waking movements, all of you should be having a pattern by now. So it should be, there is a resting time and an active time. If the active time reduces, that is when you let delivery suite know. Okay? Remember, your resting time and your active time. If your active time reduces, that is when you let delivery suite know. So what you need to do is understand the pattern of your baby. Like all of us, we sleep, right? Yeah, so the baby sleeps too. But then the baby is active again. So please, please, please remember that. Number 3.
Water breaks.
Yes. So we say shrum, spontaneous rupture of membranes, but if your water is broken. Now, what we want you to do is make sure you note the time down. Note the time down. You put on a sanitary towel, and then obviously they'll tell you to make your way in. So we can confirm it, and they will do the process and give you a plan from there on. Okay? And last but not least,
If you hurt yourself?
if you hurt yourself.
If you fall over or something?
Oh, that's general. No, but it's not wrong, it's general.
Okay.
Yeah. Ladies, husbands, come on, what? Huh?
Any pains?
What kind of pains? Contractions. Okay. So now, obviously, if you're having abdominal pains and it's consistent, and you ring delivery suite just to make sure that that's. But also, the pain would be your contractions. Now, contractions can some people start on your back, but it's intermittent. Okay, and it builds up. It can start from like 20 minutes, then go back 30 minutes, then comes 15 minutes, then comes and goes, and then it has a steady pace. Not everybody may have that steady pace, but the frequency of it is lasting more than 40 seconds, and every 3 to 4 minutes, every 2 to 3 minutes, that is what you want. Okay? And for first-time moms, right, at least give yourself 4 hours of regular contractions to allow yourself to kind of like establish labor, okay? Because it builds up. You don't just have the first spin and labor starts just there and then, okay? If your water is breaking, the baby wouldn't just fall out, okay? It doesn't mean labor has started. It just means, the process. So we want to go through all of that. But those are the 4, pain, contraction. That is because if you ring it, right, and I say to you, you're having pain. Pain doesn't tell me contraction. Contraction is a pattern of events that is taking place, where your abdomen goes really firm for the last about 40 seconds, and then it just releases out. Okay? So contractions is what I want you to absolutely focus on, and the pattern of it. Alright? So pain, we will triage that in the phone, but your contractions is, and I'll explain what the contraction does for you so you get kind of excited when it comes, because pain means baby's coming. Well, in contractions. So what we're going to do now, there is 2 sheets of paper. There is a part where we do early labor at home, and then what we do in hospital. So I know there's 1, 2, 3, 4, 5, 2, 4, 6, 8. I'm going to help you part in this one. So we're going to 4 and 4, so I'm not going to separate you 2. That's okay. So 4 of you are going to look at early labor at home, and the 4 of you will look at in hospital. So just think about being in hospital and what does that mean for you, what questions you have, and then we'll, okay. So we'll go through at home, have a bit of a break, and then we'll go through in hospital, okay? So to keep your lungs all nice and comfy. Understanding the signs.
Underestimate.
Oh, thank you. I'm waking up. So underestimating the signs. Now, when you say underestimating the signs, basically you think you're happening, but it's not.
That's one that I sort of came up with. Like,
Okay.
my thoughts are like Kelly saying, I think the baby's coming. And
Yeah.
I'm like, no, it's all right. There's football on the telly. I'll just give it another half an hour and see. Maybe leaving it too long when. So that's something that I'm worried about.
You're worried about. Okay. So I'm just thinking, then if she tells you something, you listen.
Yeah.
So
I know that anyway. That's
yeah,
what
but for everybody. But I think what we would need to do is take this. So underestimating the signs, any of us can make a mistake, even the woman. Because she might think, oh, the midwife said it's okay, and then she carries on, and then later on, oh, baby is coming. But I want that to happen, so that by the time you get there, it's okay. Okay? So, but the thing is, underestimating the signs necessarily may not take place if you listen to what I tell you today. Okay? So first of all, to understand the signs is, as I was saying before, your labor. Each of you are first-time moms. And that would be something different for you all, while you may have something in common. And the common theme is the pain, which is what we call the contractions. Remember, I say it builds up. It starts off irregularly, and then it carries on, and it has a pattern. And that is what you want. What you want, because it's kind of mild, then moderate, and then it goes to strong. Okay? So you want strong, regular contractions for at least 4 hours before you even think of picking the phone up to call delivery suite. Oh, and then, after that, that's when you ring them and said, I have been sitting here for 4 hours now with regular contractions, and I believe, I want to come in to get checked out. Yeah? Because then if you call them in and they assess you, they will send you back home if you are not doing anything. Okay? And when I say not doing anything, you are not in established labor. Alright? Now, if everybody can show me their notes, your handheld notes. Did you bring it with you? Oh. Yeah? There is something that's what you need to just do. You're not allowed to leave home without your notes. Remember that, right? You do not leave home without your notes, wherever you're going. So, at the front of your notes, it should be highlighted. Okay, yours is already done. And this one is yours, my lady. Okay? That is your hospital number. Husbands, please make a note of that. Because when you are in the delivery suite, they would ask you, what is your wife's hospital number? That's exactly what we want. Now, yesterday I was triaging, and I spent 5 minutes with a gentleman just trying to establish his wife's hospital number. Okay? So please, dads, please make a note, because if your wife is in labor and she may not be able to have a conversation, then you would be able to answer those things for us. So my lady, tell your husband to learn that number, okay? Alright. So in terms of underestimating this, so you're just doing two things at the same time. So you won't underestimate the signs if you just pay attention. Now remember I said it will build up. Some people experience it in their back, and then some people may experience it as the tummy just rises up, gets really firm, lasts about 40 seconds, and then it begins to go away. Alright? That is what you're looking for. So you wouldn't underestimate it. Okay? Now, if your waters break during that time, it doesn't mean to say, oh, my labor has started. It just means your water has broken. Remember, note the time, put your pad on, ring delivery suite, and they will call you in to assess you. And they would make a plan from there on. Okay? Because depending on when your waters break after 24 hours, they will want to make a plan for you, because the risk of infection increases from there on. Alright? And then what the type of the color of it also tells us to make a plan. And if your waters break, anything can happen in terms of the baby's, heart rate or nights, and that is why we would want to check you. Okay? So underestimating the signs, are we happy with that? And we know what we're looking for? Okay. Birth partners missing out. Now, you're at home. Now, it says early, now it says at home. The key word is early labor. Early labor at home. Because when you're laboring at home, what we suggest is the partner missing out. You can miss out this bit. Because what you have to do is pace yourself, maybe tidy the house, maybe go for a walk, take some paracetamol, have a bath. What you're doing is keeping things as normal as possible. Because this is your time. And the longer you stay at home, the better. By the time you come in, it's the time for you to be here. And that's the whole key about it. And I know none of you said you're having a home birth. Have you not thought about it? Was information given to you about it?
Yeah, we thought about it and then we decided we don't want one.
You know what? Okay. Well, having a home bed, actually you have 2 midwives there looking after you. We do not get interrupted in that session. And if anything is deviating from the norm, our decision making will be the right time and the right move to make to get you in. Okay? So people always thinking it's a scary environment. We have the most beautiful birds at home. And actually, if you do get transferred in, it's the right time to be transferred in for intervention to take place. Because sometimes when you're in a hospital, the research says you do have intervention sooner than you normally would have it if you were at home. Okay? So just have a think about it. So think about it. I'd love to come on and help you deliver. So your partner's missing out. I don't think the partner would miss out because you have to go through that stage of getting into established labor. And where if he is 4 hours away from you, then you can just drive straight to the hospital while you make your way there. Okay? But it's just being at home and staying in that place of being calm. Because we get really excited, oh my baby's coming, oh my God, water's broke, oh my God. No, just have a plan. Have a plan. So, you all didn't say if my waters is broken at home. I told you what to do with that one already. And you just carry on. So actually partners missing out would only be depending on 5 years from you, and it won't happen. Because your baby's not going to drop out just like that. Okay? Are you all happy with that? Okay, partners missing out.
Is that the same as if there's like a complication where you've got to go for a C-section?
Okay. Now if you do have a complication for a C-section, that means something may have taken place for that to happen. So for example, if you were at home and your waters break, so you're going to the hospital, they call you in to assess you. While they assess you, they check the baby. If at some point in time they see that something is wrong, then they would make a decision. And that decision don't just make, the baby would have to be in absolute distress. Or you would have been having to be bleeding or something like that. Yeah. So when they say make cesarean section, something would have gone wrong. Something would have deviated from the norm. So section is the last resort. So we haven't even experienced your latent phase, and that's what we call, your early stages. You haven't experienced that. So cesarean section is your last resort. Okay? And for example, if you're having a breech baby, or they went in and they examine you and they realize there is a breech presentation, because sometimes it can get missed, then you're thinking, okay, and it's your first baby, don't have a cesarean section there and there. Alright? So it just doesn't automatically cesarean section. Something would have taken place for them to make that decision. Alright? Okay? Any questions so far? Please feel free to talk to me, because these questions are making me divert different out. So I'm trying to fix it in to make it really nice for you. So you've got to remember, early labor at home, there's no need to worry about if your partner is going to miss out. I just want you to have a plan in place. For example, if I'm at Tesco's, if I'm in baby mother care or Boots and I'm doing some shopping and my waters break, don't panic. That's what I do not panic. Just note the time it happened, and then obviously you may not have a pad on you, but just get to the hospital and they'll assess you and make a plan from there on, okay? So even if you're at home and your waters break at home, do the same thing. If you're out walking your dogs, do the same thing. Okay? Don't panic. Just make sure you have a plan. Just bring your husband and say to him, this is what is happening, or your partner. This is what's happening, and then you all have a plan in place.
When your waters break,
Yeah.
what is it like?
Some people may think it's a trickle. Some people might say it's a gush that happens. It can happen either or. But it would flow, and it's just wet. You will soak your knickers, your clothes, and sometimes your waters may not even break until time the head is delivering, which I've had a few of that, and it's okay. All right, planning out what you need to bring. Okay, okay. So that's just like packing, right? When to pack. Okay.
We then talked about what we need for baby.
Okay. So, first of all, you're not going on a trip. You are not going on a trip. So in terms of your packing, you would put maybe about a change of pajamas for yourself, maybe a couple of robes and a vest for the baby, and a few nappies. All right? Your toilet bag, which you take with you everywhere. That is not a hand luggage. That is like a hand luggage that you take with you, not a suitcase. All right? Because what you want you to do is deliver you and get you back onto home as soon as possible. But I will get back to that. So, so you understand what to pack. Now, it would be good for you to have that bag packed by 35 weeks, because after 35 weeks, we consider everything fine with the baby. But term is from 37 weeks. 35 weeks, the lungs is completely developed and everything. So if your baby wants to come a bit earlier, that's okay for us. Baby can function. But from 37 weeks onward, that is what we consider a term. So if my baby's coming 37 weeks, it's not early, it's just the term. So if it comes then, that's fine. So people say, I had my baby early. What do you mean early? 37 weeks? Oh, it's term. So we don't worry, from 37 weeks onward, it can come 2 weeks before or 2 weeks after, to give or take that 40 weeks, okay? Yeah? We all clear? Am I talking too fast? All right. Okay. So in terms of packing, are we happy in terms of what we're packing? Yeah? If you run out of sanitary towels, I'm sure we can supply you with some. Towels, again, if you have in the shower, we will supply you with that, so there's no need for you to worry about that either. Alright? And dads, please pack the bag with your wife, so when she's sick, can you just get me some pair of knickers? She don't get angry, think, get me some knickers, and you don't know where it is. Please, please pack the bag with your partner so that you know where things are, so when she do ask you for something, because you know what, they do change. When the pain is on you, some people change, and some people change to an extreme that, who are you? But it can happen. I mean, everybody have their own way of coping with pain, and it can happen, all right? So, dads, pack the bag too, and know where things are. Okay, what can you do to relieve your pain? Okay, go for a walk. I know it's simple, go for a walk. Tidy up the house, keep yourself busy, because you want things to unfold. And you would not give birth just there and then. The first pain you have, you're not going to give birth. Because remember, I tell you what's going to happen. Your cervix is this long, right? And it needs to go from that, to that, to that, and then begins to open. Okay? Yeah. Ah. Can you all see this? I'm going to take this up. I love this bit here. So, can your baby come through this? No. Can your baby come through this? No. And this is where we call, around here about is what we say you're in established labor. And the research says 1 centimeter an hour. But that is just the research, and it's because individually you can do something different. Because we can see people progress from 1 hour to 2 hours, and they progress really nicely. And that's okay. But I want you to take in mind it's your first baby. And your body is, this is all strange to your body, so you're having to adjust to what's going on. Okay? So please, please, please bear in mind, during this phase, I want you to try and not think about, oh my God, I'm in labor, oh my God, things are... No, just think, okay, I've started this journey. I'm soon to meet my baby. It's going to take me some time, and I will get there. And the more pain it becomes, the more painful it becomes, it's a beautiful thing, because you're soon going to meet your baby. And the pain will increase. It will. Now this is what you need to get to 10 centimeters. But you can stay home with the first 3 centimeters. And so for pain management, you can have paracetamol every 4 to 6 hours. You can have what we call the TENS machine, and the TENS machine just mirrors the contraction. You can hire it or you can purchase it, up to you. And you can have a bath. You can have a bath, okay? Do those things to just keep yourself in that place of calm. So when the pain comes, do not panic. If you're going to take anything away from me, besides all of this here, do not panic. Let the pain come and embrace it. The more pain you're having, it's a beautiful thing. Pain is, this is one time pain is beautiful. Because you're going to meet your baby soon. I'm coming out to scream. Okay. So are you happy with pain relief that you can use at home? And you can jot it down. Nobody's taking notes. You're going to remember everything? All right, baby. All right. Okay. Okay.
Distract yourself and clean and bake if you can.
Now, I cannot stress this. Whatever I say here today, all of these override it, okay? Everything I would say to you, this is what is important. And for this bit, you would have given yourself that 4 hours. Or if you're not coping with the pain that is coming, then they can probably do something about that for you. Okay. When do I go to hospital? When would you go to hospital?
When you're in established labor, so your contractions are a certain amount of time.
Okay. For how long?
4 hours.
Okay. Or you're not?
Coping with the pain.
Okay. And?
Any of the 4 reasons on the left.
Daddy? Mommy? Mommy? I don't understand. It's good that Dad's paying attention so they know how to support you when the time comes. Thank you. Awesome. So you're happy to know when to go to hospital? Yeah? Hey, how are you? Do not call the ambulance. Do not call the ambulance, okay? When you speak to the midwife on delivery suite, she's going to go through a list of things with you. So just bear with her, because there's a triage list that needs to take place. And then she'll tell you either to make your way home or to just wait for things to unfold if you call too early. Okay? So getting to the hospital is, you can either get, if your husband is not home, get in the taxi and tell him to meet you there. But do not call the ambulance. And you would only call the ambulance if you collapse, or if you started hemorrhaging and it's not stopping, or if it's actually an emergency. The ambulance service is not our taxi in normal circumstances, and giving birth is normal until something deviates from the norm. Okay? Alright.
And if you're driving, there's the drop-off space.
Yes.
Yeah.
Absolutely. Thank you. There is in front of the delivery suite when you come in to the maternity reception, there is about 1 to 3 spaces and it says drop off. And you have half an hour to stop off there while you bring your partner in and get them settled and then go back and move the car. And in terms of, we'll get back to that in hospital, but this is how you get in there. So yeah, there's a drop off space, get everybody sorted out and then go and sort the parking out. Okay?
I just said, if any of you has never been there, maybe it's nice to get another little look, because sometimes they're always busy, those parks there. So just really to know where they can park and nearby as well.
That's a good idea. But you can also go online. If any of you all go online to the LND website, and there is a virtual tour. There's a virtual tour online, and it will just give you a bit of a snapshot of the environment and what to do. Because especially if you're coming in at night time, there is a buzzer that you would need after 10 o'clock if the doors get shut down. So there's a buzzer for you to buzz in, and then they would allow you to come in. Okay? So it's knowing all of these little things, and thank you for that.
Yeah, it was just for the parking space, just
No, that's okay. That's okay. Is everybody happy how to get to the hospital? Is it important not to be on your own? Well, I don't think anybody wants to be on their own in labor. Or even, so remember you're at home. So in terms of this part, I have explained to you how to keep yourself in a calm place. And you have to trust what I'm saying to you. and trust yourself that you can cope with this. Yeah?
Yeah, it's just because a girl at work, she had a baby, and she was obviously talking to me about it, and she said she was at home on her own, and she got in the bath, and then her pain, she felt her pain was so bad she couldn't get out of the bath to let her mum in.
Okay. Was that her first baby?
Yes.
Okay. And how long was she at home for? Okay. Okay. So then what would you take away from that then?
Well, ideally I wouldn't get in the bath.
So, just for viewers' sake, if you are planning to go and have a bath, I think you'll be looking at the timing and just be mindful of that so that you all don't put yourself in that position where you cannot move. And she probably would have been in that position of, oh my God, things is happening. Because when you reach that position, she would have been, I don't know. I don't know. I need to know that story for me to give an answer for that.
Yeah.
But please do not get in the bath if you're in established, well, how would you know you're in established labor? You would have had 4 hours of regular contractions, right?
Yeah.
Oh,
I guess if you're not coping with the pain.
yeah, if you're not coping with the pain, yeah. So please be careful. Do not just jump into the bath and you reach that stage. Then you would have called the hospital already. And if you're alone home, don't get in the bath on your own.
Yeah.
That's the question, okay? What to do if early? Okay, so that question was the gestation. So anything from 37 weeks onwards is term, so the baby can come anytime like that. Anything under 37 weeks is preterm, and again, if that is happening at that, anything under 37 weeks, you're in delivery suite. Yeah. Okay? How quickly help can arrive if at home alone? Okay. Now remember I said, when you're home and your labor has started, or the pains have started, or the contraction have started, it builds up. So in terms of how you can help arrive, it all depends on how you are coping or you are advancing. So it will be you making a decision. So when you have the first pain and you're not there, and your husband is not there, would you not say to him, well, babes, I don't know what you call him, but you would say, I think my pain has started, I'm just going to maybe have a bath now, I'm just probably going to take some paracetamol, I'm just going to walk, I'm just going to tidy up and do something. You will be communicating, wouldn't you? You wouldn't just keep quiet with that pain. You wouldn't. But it gives you the opportunity to do stuff. It gives you the opportunity to do stuff because it's a build-up. Okay? And then, obviously, then you all would have made a plan in place. So this wouldn't just be something that just happened unexpectedly. You say, okay, I'm 37 weeks now, and baby can come anytime. If I'm not at home, what are we going to do? But just remember, the baby's not going to come straight away. But you make a plan. Alright? Are you all happy with that?
If
Yes?
you're having a home birth, for example,
Mm-hmm.
and you've got to wait for the midwife to come, is a midwife booked at a certain time, or do they just kind of come anytime?
Okay, so if you're having a home birth and your pain starts, you would ring delivery suite, say to them, your wife is planned home birth, and her contraction has started, and they would take a story from you, and then they would ring us. And they would speak to us and say, you have a home birth, and she's doing this and that and that. And then we would call you, have a conversation with your wife, friendly, because her conversation tells us what's going on. Sometimes, or she might be a very good person who copes with pain. She may have a very good pain threshold. But it's just the fact of us making sure that we come and assess you at home. We will assess you at home, and then and depending on what stage you're at, we would say, okay, if you're not in established labor, we'll say, well, go away, carry on our day, and then we'll call you back maybe in 4 hours, see how you're getting on and stuff like that. And then when we come again and we examine you, and we think, okay, you can carry on, so then we stay with you until the journey. Somebody comes and releases us to take over when we finish work, so that carry on. But we look after you at home. So it's different when you're at home. Okay? We come to you. You don't have to go to the delivery suite. Alright, so in terms of how quickly help get arrived to you, do you realize how that fear is already put away? Actually, it's not going to really be fearful. How far away do you work from him?
It depends. He works loads of different places.
Okay. Can you leave the country?
No.
No. Then he can get there. All right. He can get there in an hour, 2 hours time. You're not going to give birth from the very first baby you have. And this is at home. So basically what we're trying to say to you is you can be at home for the first few hours of those contractions, and then by the time you get to hospital, it's okay, you're ready to stay there. If they examine you and you're not there, and you're not ready yet, they will send you back home, and it's okay for them to do that. As long as they check you over and everything is fine, they will send you home for the process to unfold. And you're better off in your own home environment because it's something you're accustomed to, and it's safe, it gives you a sense of calming. But you have to trust what we have given to you. Trust, and it's our job to listen to you too. So if you ring us and say, I'm not coping, then we have to listen to you. But trust what's going on with you as well. Yeah? Do that, really, really, and keep yourself in that place of calm because baby is coming. That's the exciting thing. Packing your bag, we've discussed that. Food. Now at home it's really important to keep yourself hydrated and to eat little and often. And every 2 hours just empty your bladder. Every 2 hours just empty your bladder. Because the process of descent is taking place and what we don't want is obstruction. So empty your bladder every so often. But keep drinking and keep emptying your bladder. That's going to keep you busy. So you're going to be either walking the dog, peeing, drinking, eating, taking pain relief, but doing something, but getting excited about what's coming. Okay? Look forward to it. It's the time that when you have baby in the future, it's not going to be the same. So each pregnancy is always an individual pregnancy. So enjoy it. Enjoy it. And even the pain, enjoy it. It's your time. Enjoy it. So we're happy with food and snacks. Okay, let's
So
go.
with regards to food and snacks,
Yeah.
we say to pack some, don't we, just in case
Yeah.
partners need them.
But when I get over to that side, because then we're at home. When I get in, you can't feed them, but they're at home. You're still at home. You're still at, but I'm talking to the women. You keep yourselves energy. It's your energy that I'm talking about. Because you know running a marathon? Yeah, you run a marathon. And running that marathon, you have to keep yourself hydrated. That's how intense it is. But you get through it because you're not on your own. Actually, we're there with you. Even now, I'm telling you this, and you'll remember me saying to you, keep calm, take my pain relief, have a bit of a walk, wander about, keep myself hydrated. It will be in my mind. Okay? Free yourselves, drink tea, and then we come back. So welcome back. So now we're in hospital. So we have followed everything I advised, and we're thinking, okay, we waited for the 4 hours, or we think we're not coping with the pain, or we think whatever may happen here. And so we're in hospital. When to go in? So we all know when to go in. So I'm just going to take that. We all know when to go in. Yes, the audience said yes, they're happy when to go in. And that is everything we've discussed before. Complications. Now, complications for us means something has deviated from the normal process. Okay? So, on page 16, go to page 16, you all would have started discussing your birth plan or making what it's going to be like, what you would like to encounter. The reason why we say to make that birth plan is that you are in control of the process. And if something deviates from the norm, you know that nothing has been taken away from you. Is the fact that we need to do something to make sure both mom and baby are safe. Okay? So when the word complication comes in, I want you to think, I did my birth plan, and I'm not getting what I wanted because something has deviated from the norm. Complications can stem from bleeding. It can stem from if you're high-risk pregnancy, for example, gestational diabetic or preeclampsia, or an older mom with a raised BMI. So many different things can talk about complications. It means my baby is back to back and I am not able to push the baby out. Because back to back means the diameter of the head is looking up at you and saying, hi, how are you doing? You know, it's back to back. And obviously that diameter is a very large diameter to go to the pelvis, and for some women it's a bit difficult to push that baby out, especially if it's your first one. Okay? So complications can mean so many different things. But all you must remember is decision will be made for safety of both mom and baby. And complications can mean having an emergency cesarean section. Okay? For example, if your pattern was going along nicely, so I said, oh, recognize, we examine you on your breech presentation, complication, you have a cesarean section. We're going along nicely, and somehow the baby is a bit distressed. So when you have a contraction, the heart rate drops, which is normal, but the heart rate drops and it's taking longer to recover. What's going on? Complications. Let's see what's going on. There are steps we take to make sure to assess the well-being of the baby during the process, but again, that's when you're in hospital now. So they might explain to you, oh, we're going to do what we call a fetal blood sampling, just to check the baby's oxygen level and how it's coping, you know, all these different things, complications. The thing about complication is, all I want you to remember is, with your birth plan, you have a plan. If anything deviates from the norm, complication, think complication. And then, okay, they're going to make a decision for safety of me and my baby. Okay? And that's the best way I'm going to explain complications. For example, you can reach the second stage, well, you're fully dilated, and baby is ready, you're pushing the baby out. If that during that time, which can happen an hour and a half of pushing before the baby comes, you will think, oh my God, the baby's getting a bit distressed. And they'll probably want to assist the baby to bring the baby out. Okay? So that's called assisted delivery or instrumental delivery. Complications. Complications doesn't always have to have a negative outlook on it. It just means we making executive decision for safety of mom and baby. And that means is when the obstetrician comes in, because during the time a midwife is always with you. When you're in labor, yeah, the midwife is looking after you. The doctors comes into the room, complications. Remember decision making. Okay, they have to make decision that is going to be in the best interest of both of you. Okay? If you have any questions during that time and you feel like you need communication, just say, can you explain this to me? Can you explain? Because we should be explaining to you. Alright? So don't look at complications as a negative thing. It just means, okay, they're going to make some decisions for the safety of me and my baby. Alright? Is that okay with complications? Types of pain relief. In hospital. And at home, if you're having a home birth, you can have a water birth at home. You can have gas in there at home. And you can have paracetamol at home if you're having a home birth. And you can have a water birth as well. In hospital, you can have all those things as well as an epidural. Okay? And even if you want an epidural as a pain management, if you stay from now, I've looked at all the pain methods, and I prefer to have a pain epidural, then you put that in your birth plan, and they would know to give you that early onset so that you carry on. Okay? So, you have your, there's also Hesitin, and I like that. I think it's really nice because they give it to you with what we call Finnegan, and it's like a nice combination of it keeps you asleep and it keeps the pain going, and then you wake back up, oh, pain's that, you know, pain, and you go back to sleep, oh, pain comes again, oh, you go back to sleep. So you rest, and then by the time it's, you know, oh, you have progressed so nicely. Because what is happening is your body is resting. So I love that one, I had that one. And again, there's the epidural. There is side effects to everything that we use, it's just the degree of it. And the anesthetist will explain that to you if you decide to have an epidural. Okay? Paracetamol, water. And water is also a very good buoyancy, very good pain management as well. And then we have the gas in it. I said, this woman was so scared, right? When she had the gas in it, it just took her mind away from everything. You said, okay. And then she was, you know, it keeps you in a nice place. Some people vomit a lot with the gas in there. Some people just talk a lot. Some people cry a lot. It has different effects in you, but it's really good. Some people kind of agree with it, and they just rather carry on with it. Okay?
What about dads? Can they have a go?
No dads, no. We'll call security for you and put you on. No. Dads. And dads, if you're planning to fall down, just just let us either make you rest nicely on the floor, I will put you aside, or just ask her to leave the room. It's okay, because we will cross over you. The woman is the most important thing in that room. Okay? So just mind that. We'll care for you, but we'll just carry on. So are you happy with pain relief? And remember, you can go over this with your midwife, yeah? And then she can say, you can do further reading, because different, we have different apps. We have the Baby Body app, we have the booklet that we give you about pain management, and it's all there for you to go through it. Anything you're not sure about, please speak with the community midwife, and she can add anything that I have forgotten today, okay? Length of stay and discharge. Now I want to stress on this, and especially for the public. I want to stress on this, and I want to really say to you, your length of stay will depend on the outcome of your delivery. So if you had a nice normal delivery, and baby has established feeding, if you're breastfeeding, baby's feeding well, you can have a 6-hour discharge, okay? And within that 6-hour discharge, there is a special check that we do with the babies, that there are midwives who train for that, and they would come and do that check there. So you don't have to worry. If baby needs a hearing test, they would follow that up in the community. So everything gets followed up in the community in the timely fashion, and you would not be forgotten. If you stay longer than that, either because we're not happy with the feeding, or there is some complication that causes you to be in hospital a bit longer, okay? So just remember, your length of stay in hospital would all depends upon the outcome of your delivery. All right? Now, when it's time to be discharged, if you're on the ward, it will post 24 hours. Now, the midwife will come to you and say, well, the doctor, if you had a cesarean section, the doctor will say you can't go home today. Please, please, please says today, that word today, because we can be so busy that if there is 10 people to go home, we do not have 10 midwives for all of you to go home at the same time. Okay? So if in the morning time especially they said, oh, you can go home, oh, you can go home, and then by 5 o'clock in the evening you're thinking, well, you said you might go home this morning. If they do say, give you a time, please forgive us. Please forgive us. When they say you can't go home, leave that day. Just say, Brian, I can go up today, but I'm not sure what time as yet. Because we can be so busy that we may not, if they say I give you a time in the morning, expect to be there for a while. Just bear with us. It's okay to wait. Yeah? Just bear with us, please. It's okay to wait. Yeah?
From experience, I was told in the morning, go home today, it's fine. But because of being here, I knew that there would be a bit of a delay, and it means that you just carry on, have your lunch, carry on, and then you're going at 4 o'clock. But if you know there's going to be a delay, it's easier. Otherwise, in your head, you're going crazy that you want to go home. You know?
Yeah, because people can get a bit distressed,
Yeah.
and we understand that. So what we want is remove the distressing experience. All right?
If you have a home delivery, you don't have to go back to the hospital to check the baby.
No. Thank you. If you have a home birth, unless there is a reason that we thought there was some kind of complications, then you stay at home, everything gets done at home. You don't have to come into hospital. And that's why we call it home birth. You don't have to come in. Unless something deviates from the norm. Okay. Anything else about discharge or length of stay in hospital? Okay, support of breastfeeding. Well, all of us should be competent to give you support with breastfeeding. So we wouldn't just leave you there. And I know many people have different experiences about that. So my thing would be, breastfeeding should not hurt you. Okay? And if it is hurting you, it means the position of the attachment is incorrect. So we need to get that sorted out. So if you're breastfeeding your baby and your nipples are hurting you, take the baby off and try again. Okay? So if you take anything away with regards to breastfeeding, it should not. There is a breastfeeding session, and Susan will tell you about that afterwards. Okay? Okay.
There's also a breastfeeding team at the moment.
Huh?
There's also a breastfeeding team, isn't there?
Yeah, and the breastfeeding team comes out at home. So this is when you're in hospital. Yeah. So when you get discharged from hospital, and if you're still needing follow-up, when we come home to see you on your following day, we can make that referral and make sure somebody comes in and check in on you. Alright? But the support is there. The key is the support is there, and please keep asking for help. Don't stop asking for help. Even if you need it 10 times within that day, don't stop asking for help. Okay? You alright? So far, have I made you all feel at ease? Awesome. Who is going to look after me? I like that. Who's going to look after you? You would be introduced to a midwife, and then they will let you know how long they'll be caring for you. Sometimes on delivery suite, depending on the intensity of the workload, they may have a couple of patients looking after. But they would always prioritize, if you're in established labor, they won't leave you. Okay? Unless they have to go and get something for you, but they will be there with you. Alright? And some people, in a student, plus or minus, we're a teaching hospital. And because we're a teaching hospital, it means student will be doing, looking after you and being supervised while they look after you. Now, if you do not want a student to look after you, you can put it in your birth plan. Okay? And that is a choice that you have. We can only go along with your choice. We cannot force anything on you. But please welcome them, because I was a student once, and it's such a privilege to be able to get to know you all and be able to support you all during that time. So we have a lovely student here, and it would be really nice to engage them in your delivery. But that choice is always yours. Okay? So for birth partners, thank you. I love how you did that. And your birth partner is also there with you. Now on delivery suite, you can have 2 birthing partners. It's not a tag team. So one guard, like for example, by the end of the day we might have seen 10 people. Absolutely not. They would not tolerate that, okay? But you can have 2 people who accompany you while you're on delivery suite. And for the length of time you're on delivery suite, those 2 people can be with you. From the minute you are transferred to the ward, the dynamics change, okay? Which meaning it's much more controlled in terms of how many people are allowed in at the same time. So there are different visiting time. Your partner can be with you. I know they say 9 till 9. And there are some dads who stay overnight to support their wives after giving birth. But you would have to speak to the sister in charge to be able to facilitate that for you, okay? So there is an ability for you to overnight after giving birth on the ward. But again, you would have to speak to the midwife in charge to facilitate that, okay?
Do you have to confirm who the birthing partners are beforehand, or can it just be anyone who turns up on the day?
No, whoever she wants to be. You would know who you want to be with you. For example, most people don't like their mother-in-laws to be I'm joking. Some people don't want them. I remember we were doing a session, and the one can my mother-in-law not come? I said, of course she cannot come. Just let them, you know. Again, it's who you want to be there. Obviously, you wouldn't want to miss it, but if you unfortunately you have a contingency plan in place. It's who you want there, and you can have 2 people there with you.
So if you don't want someone there, and you tell them, I don't want you to be there, and they still turn up.
But then you can tell delivery suite that there is someone there who you do not want to come in, and then they would say, I'm afraid you cannot come in. Because there is...
Sorry. Even if you've written it down on your birth plan, if you change your mind on the day, if you've put 2 people and say, no, I only feel comfortable with my partner being here, then you just tell them, just say, I want that other person.
Yeah, because we have to respect your choice. We absolutely have to respect your choice, okay? So your choice.
You look relieved.
Absolutely, it's definitely your choice. Any questions so far? Are we happy? Okay. Students, so we've done that parking. Now, back to when you come in parking, now, if your wife is in labor or when she's in labor, we allow you £4.50 for the whole day. So they would give you a slip that you would need to fill in, and then you take it back to them and they would sign it, and then you put it on your car. But you would have to pay the first £4.50, and that is all you pay for the whole day until you get birth and then get back to the ward. If you're coming in for induction, which means you would have gone post dates, and that's what we call induction of labor, and you have to come to the ward, that induction can take 24, 48 hours. So again, that would be £4 for the day for parking. Alright?
No. Sorry, I was just.
Okay. So that is something at least we give you while you're there. You don't have to pay £20 or while you're in labor for 20 hours. Oh, by the way, your latent phase can take up to 72 hours. And that phase is where you're still waiting to be in established labor. It can take up to 3 days. Okay? So don't panic. Don't panic. Remember, if you do everything I ask, yeah, you pace yourself through the process. And remember, if you're not coping, then let them know. But give yourself that time. If you're concerned about the movement, let them know. If you bleed, remember, don't be too distraught if after 3 days you still have a niggling and you're thinking, I'm only 1 centimeter. It's okay. It's because the process of the build-up. And each of you are an individual. Yeah? My time was 6 hours and 20 minutes from beginning to end. From the very first pain to the end of it. Yours can be 72 hours plus. But actually the 72 hours is not counted because you haven't even started. So I don't want you to get discouraged. Just keep in mind, it can take 3 days and I'm still not doing anything. Okay? Yeah. I'm giving you information so you make choices later on. That's what it's about. After my baby is delivered and bonded, now, some of us have different aspects of receiving a baby. But one thing we do know, when the baby is born, skin to skin. Skin to skin releases the hormones that calms you down, relaxes you. The baby is happy, nice and warm, and that connection takes place. Some of us says we're not maternal. Hey, hormones change you. When the baby comes, you're thinking, wow, this is my baby. I did this. And one of the joys that I look forward to, I'll always remember this. She's pushing, you're screaming, higher, you're giving birth, you're doing everything. And then the minute the baby comes, there's a different look on your face that is priceless. It doesn't matter what anybody says to me, that is priceless for what I see. Because the change of seeing your baby from after all that agony, it's absolutely beautiful. And then the skin to skin. And then the bonding takes place. Now for all of us it happens differently, but it does take place. So just keep an open mind, I will bond with my baby. And as long as you have that open mind, it will take place. Alright?
Is it unheard of skin to skin?
And fathers do skin to skin?
Absolutely. And again, it's a choice on your birth plan. Do I want skin to skin or do I not want skin to skin? Okay? And this is a very important time. A very important time. And for example, some people may have had like cesarean section, and because of the event of the cesarean section, they may not have time to have that initial bonding with the baby. And some of them say, I struggle. And it's okay. It's okay. But the thing is, don't let it become a barrier. Don't let it become a barrier, because you may not get the initial skin to skin, but the fact that you're joining with your baby now, give the baby skin to skin and let the bonding carry on. Because you're still having that contact. And it's that contact, and because that baby knows that happened for the last 9 months, and to hear that again, just put in that place of calm. And for you, it also releases hormones that really helps you stay calm as well. Okay?
After you've given birth, do you then get moved to a ward, or how long do they leave you in the delivery suite?
Well, you can stay in the delivery suite again on the outcome of your delivery. If everything was nice and normal, they will look about, okay, are you feeding properly? If you're not feeding properly, then they will think, okay, we need to keep you in a bit longer. So it varies. There is no specific time, and you would only stay there any length of time if you were in the high risk category that you needed to stay there for one-to-one monitoring. Yeah? So, and again, if they cannot discharge you straight away, they would send you to the ward, and then you can go to the ward, and if you have to wait there for a bit longer, again, it all depends on what's happening on the day with yourself. I can't stress that enough. It's such an individual decision, an assessment. Because everybody who comes through the door is an individual, and we have to respect that. So your needs might be different to your needs, might be different to yours, might be different to yours. Yeah? So it's all based on that day what happens. So I cannot give you a board and say this is exactly what's going to happen to you, and if that doesn't happen, then I failed. No, I can't do that. But don't panic. The key is not to think that we're going to chuck you out. We cannot just chuck you out. Okay? And if you want help, you say you want help. And it's our job, our duty of care to make sure that you are supported and provided the care that we need. It's such an individual thing. We cannot stress that enough. Every woman, I can see 30 women throughout the day, and each one of them I have to treat as an individual. I cannot put you all in a group and give you all the same care, because then I would not have met your needs. Alright? Restriction to visitors. Have I made myself clear with that one? Okay, especially on the wards. Please do not bombard the wards with visiting. And sometimes, you know, the midwives and them are so busy, but they're having to battle at the door with visitors because it's not being respected. And they have ladies who need their attention. So please tell your relative, if this is the visiting time, you can come in and it's 3 people to a bed, including the partner, when it's on the ward. Yeah? And there you can give other people time to come in. So maybe leave and say, okay, let me let someone else come in. But please, please think. I think what we don't want to do, number one, is for safety, not overcrowded environment. And again, we need to keep an eye on what's happening. Because sometimes what we don't want is an incident to take place, and then who's going to be blamed? Okay? So it's really crucial that visiting is really respected. Yeah? It's both safety for mom, for baby, and for everyone else. How long can you stay? And again, that is all dependent on the outcome of your delivery. If you have a cesarean section, sometimes one lady went to mom after 24 hours. You can go mom to 48 hours, 36 hours, but it all depends. Okay? And then when you're being discharged, please bring the car seat. And while you have the car seat at home, learn how to do the process of putting it together, because they do not train us how to do that. No, they don't. They don't train us how to put the car seat together. So please make sure you fiddle with it so you know what you're doing when to discharge baby. So you can only come with the car seat when the midwife says, oh, you can go home today. And so they say, oh, hubby, bring the car seat. I can go home today, but remember, we do not know what time. So let's not panic. Okay? Support from partners. Now I hope the door is open. As I said, the midwife will facilitate if you can stay overnight. None of you having twins? No twins on board, okay. And again, I hope that your partner would be there supporting you throughout the whole process. And you have time off work, and then that could take place. So that support from the partner would all be dependent on you. That's partners. It would all be dependent on how you choose to support your wife. And I hope that you would stand by her side. Even if she pukes on you, it's okay. That's part of it. Waterbed, we do support this. And there is one on delivery suite, there's one on MLBU. And again, of this availability. So we have 2 pools, and if it's available, you can have a waterbed if you want a waterbed. I think there are a couple, maybe a few midwives who are not waterbed competent, and they are working on that to make sure everybody is able to provide waterbed service. But again, it's there if you wanted to. You can have it at home, or you can have it in hospital, or you can have it in the midwifery lab 30 minutes. What do we need after the bed? What do we need after the bed? What do you mean? A hat. Oh, I forgot. When you pack the bag, make sure, because the first 12 hours of life, we keep a hat on the baby to maintain the heat. But after you go home, please, please do not put any more hats on the baby. You don't want to overheat that head now. Okay? The first 12 hours is okay, but after that, it's not okay. Okay? So make sure hat, because after babies, but we'll put a hat on to keep it nice and cool. Virgin aids. Yeah, music. Some people like nice sea bashing and flowing. You know it bash. Waves flowing. Some like classical music. Some like reggae. Some whatever you fancy. A Burton ball. I think we have a few in the unit, so you don't need to bring your own. We always, what I would say, Burton aids, leave the bed alone. Come off the bed. You know, You know, a nice rocking position. Keep yourself in that. If you want to lie up, lie on your left side. It's like if you're running, squatting, best position for you. You can, and what we want to do is make sure that the outlet is wide enough so the baby can calm down nicely. So you don't have to stay in bed, okay? You can give birth kneeling down. You can give birth any position on the floor. It's okay. We just get the position for you. You don't worry about us. You just be comfortable. Yeah. So birthing aids is absolutely fine. Whatever you want. If you have a comfy pillow that you need to bring with you, bring your pillow. What we want to try is make sure and create a kind of normality. We want to remain in that place of normality. So if anything deviates from the norm, then we know, okay, complications is happening and we need to fix it. So it's best for mom and babe's interests and safety. Okay. Have I missed anything? Is there anything that that was discussed but wasn't made clear? Or maybe you have a question that you needed to get answered?
Do you have an epidural at home?
Baby? No. Remember I said? Sorry, I said me. No, you can't. So I'm just gonna, because you know sometimes they have like, so just to give you, now you will be on this monitor, complications. Or unless it's a choice that you want to have continuous monitoring. But why would you want to be continuously monitored and it keeps you a bit restricted? Then you can walk around and be auscultate. Yeah? So then in the books you would see on page 16, it gives you a choice of what you have. Yeah? And again, but majority of the time, a woman will be on a monitor if she was considered to be high risk or we are a bit, we're taking the complications. Okay? And then we have, this is like we say assisted delivery. This is a forceps. And this just means you have been dilated for 10 centimeters and you've been pushing and they're thinking your baby's getting a bit distressed or you're tired, you can't do anymore. But we need to get the baby out ASAP, and the baby head is right there, so they will help to bring the baby out as well. It looks a bit daunting, but actually, remember we're thinking safety. And then this one, what we call the ventouse. And yeah, the baby does come with a bit of cone head, but it subsides. So don't be too alarming. If you see the cone head, know it will go back. Alright? Yeah. Okay. Alright?